Hello, I'm Dr. Brandt Gibson, and I am back today to talk to you about another problem that is quite common in my podiatry patients. It's called a neuroma. How are they going to present? A lot of times you'll say, okay, I feel like I've got a marble or a BB or something underneath the ball of my foot, right behind the toes. Sometimes they may say, well, I do certain activities and my toes go numb. Or maybe you're getting electrical shooting paying out to the toes or up the foot when you do certain activities or after being on your feet for a while, especially if you're walking barefoot. And any of those descriptions can actually explain a neuroma, which is an inflamed nerve that occurs typically in the areas just behind the toes, so right in this general area, that can cause numbness to these toes. So between each of these metatarsals, you actually have nerves that supply a branch to each of the toes that it's going towards. So between here, it's going to go to the first toe and the second toe. Here, it's the second and third toe, and so forth. If you get pressure on that nerve, whether it's from the shoes being too tight and pushing those bones together, or whether it's from the way you walk, you actually put additional extra pressure on that nerve. The nerve itself gets inflamed, painful, and tender. Because of that, then every time you're walking, you start to feel it and you start to say, okay, that's what's going on. And you'll get possibly the numbness, or you'll get the feeling that you've got a BB underneath or a marble or something underneath that foot that's causing the discomfort. And that can be pretty problematic and can start to interfere with the activities you're trying to participate in. So where is it most common? Usually between the third and fourth toes, or the second and third toes. These are the most common areas. You can get it between any of them. You can also get on the outside of the fifth or the inside of the first, although these are less common. So with that information, you start to say, okay, I'm getting that feeling in the ball of my foot. What do I do? There are three ways you can treat this. One is not where you're going to start, but it's a way to fix it. You can go in and do surgery, and you can take a portion of that nerve out. The disadvantage of that is there's about a 20% recurrence rate where the problem comes back. So in the process of doing the surgery to help prevent that recurrence, you want to bury that nerve, or you want to have your physician bury that nerve in the muscles in that area to reduce the chance of a recurrent neuroma. But most of the time, we don't even need to do surgery for this type of problem. Most of the time we can treat it conservatively in one of two ways. Well, truthfully, one of three ways. The one way you could actually do, you want to reduce the inflammation. So you can do a cortisone shot to the area, or you can use a laser or some other mechanism to decrease the swelling of that nerve. And this is usually, one of these two is usually the second step that we will do. You say, okay, I need to reduce that inflammation because it's just not getting better. Usually the place we will start is even easier than that. We use a pad, it's called a metatarsal pad, and what it will do is it sits right behind the ball of the foot. So the pressure spot's right there, you're gonna put the metatarsal right behind it, and it sits there and it takes the pressure off the ball of the foot, and it also spreads those metatarsals out so that they're not getting pressure on the nerve. By doing that, most of the time, within a 2 to 4 week period, the pain will improve and the discomfort will be alleviated. These metatarsal pads can be kinds that are made of felt, they can be made of gel. The ones we have in the office now are gel, and they can actually stick to your foot, so even when you're walking barefoot, it's still doing the job. We also have felt ones that can stick to the insoles of your shoes. There are metatarsal pads that you may be able to find on the internet or on other stores. The placement is the key. If you put it in the wrong place, it will increase the pressure on that nerve and cause additional problems, as opposed to putting it far enough back where all it's doing is taking the pressure and taking it from the ball of the foot, moving it away from the area that's causing the pain. So, recap. A neuroma is an inflamed nerve. It usually occurs between the metatarsals. So in these areas right here, between those metatarsals, you can get numbness to the toes, although that's not necessary. You can get the feeling of like you've got a marble or something underneath your foot. Again, that's not always the case, but it can be the case. And you will get pain right in the area of the ball of the foot. And it's quite common that that would be a neuroma type problem. Metatarsal pads, the easiest place to start. If that's not working, you can do a cortisone shot or laser to decrease the swelling, or if in rare situations you can go in and take a portion of that nerve out to fix the neuroma problem. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day number 13. Morton's Neuroma. And tomorrow we will be talking about another problem that causes pain to the ball of the foot, but it's underneath the big toe.